Good morning, my beautiful people. Thank you so much for coming back. I am back with another video. My name is Saima Nadeem, and today we are going to talk about the interview questions for healthcare assistant job. If you have no experience of working in the UK, if you have no experience of healthcare, or if you have no experience of working in the hospital setting and you want to apply for this job and you want to pass this interview and get the job, stay tuned, watch the video till the end. We'll be sharing all the questions and how to answer those questions to get the job of a healthcare assistant with no job, with no experience and qualification. So if you are interested in this topic, stay tuned and watch the video till the end. Thank you. Let's say you came on a dependent visa or a student visa and then you're looking for a job. I think you can apply for the healthcare assistant job. It's really good and they pay good amount of money as well. And then it's easy to get job as well because there are loads of vacancies of healthcare assistants. There are loads of vacancies of housekeepers there, and you don't need experience as well. So I would suggest, if you're looking for a job, desperate in looking for a job, just apply for a healthcare assistant job, and when you get any better job for if you are a professional, then you can change it. There is no harm in changing the job later on. All right, so the first thing they can ask you about a healthcare assistant job would be, tell us about yourself. So how are you going to answer that question? You need to tell about your qualification, your name, your qualification, and then your skills, your expertise, and how you think you are the best person, how you think that you can do this job well. So this is the thing, this is the time where you need to stand out, where you need to sell yourself. You need to tell them that you are highly motivated, you are passionate about patient care, you are passionate about giving care to the people. So this is the thing you're gonna tell in the question if they ask you about tell us about yourself. Okay. Ask you about tell us a situation where you have to tell us about a situation where you handle a difficult patient or a difficult situation. If you don't have any experience, you can tell them that I have no experience in medical, but if I have to deal with a difficult situation, I'll be very kind, I'll be very empathetic, I will try to understand what they are saying, I will listen to them attentively first, and then get to the point why they are upset, why they are being difficult. Is it me making them being difficult, or I will try to find out the reason why they are being upset or why they are being difficult, and then I will explain it to them that why this happened, whatever the situation may be. And you can tell them that I need to find the root cause of the situation. I'll listen to them, I'll find the root cause of the situation, and then I'll come up with a suggestion according to the situation. If they are being difficult about the care, or if they are being difficult about if they are saying that they don't want any care, if they're refusing to have a wash or something, then you need to tell them about the pros and cons of that situation. Tell them that personal hygiene is very good for you. We need to clean, we need to give you a bed bath so you feel confident, and then it will be good for you as well, because you are staying in bed. It's not good for you staying in the bed all the time. We need to mobilize yourself. Give them just the reason that if someone is being difficult, you are not just going to leave them there. You are going to come up with a suggestion. If you can tell them that, okay, I'll come back after a few minutes and then I'll ask you again, and you always need to go back to the patient again if they are not happy to talk to you at that time. So this is how you can answer their situation if someone is being difficult, if someone is being difficult to handle. And you can try it by yourself, that I will ask them what is the reason why you're thinking that way. You need to listen to them attentively and come up with a suggestion. If still you are not, if they say, okay, you have tried yourself, you have tried everything, and they're still not happy with this So then you can tell them that I will report to the senior member of the staff. I'll report either to my nurse or my supervisor or my manager. Okay. Question they can ask you about, tell us about an achievement that you are proud of. Like you can tell them that if you have done anything in your life and you're very proud of that, you can tell them. Since you don't have any healthcare experience, you can tell them anything you want, but if you have experience, then tell them about the recent achievement, that you've been a good team player or good team worker, you've been awarded with a star or something. You can tell them about that. I think if you don't have an experience, you can still go, but I would say it's best to have at least 6 months of experience. And especially with the home cares or agencies, they are very happy to hire anybody without any experience. And then for 6 months you can work there and then get the experience, and then you can move to NHS, and it will be really good for you. If you get that experience, it will be very easy for you to adjust to the environment as well, if you have at least minimum 6 months of experience. Okay. And then if you have experience, then you can tell them about your achievement of being a good team player, or being a good member of the staff, or I've been rewarded as a star of the day or star of the month, whatever your achievement is. And also ask you about tell me about your strengths or your weakness. They can ask you like only strengths or only weaknesses. So strengths can be anything. You can tell them what are your strengths. You have good communication skills. I'm a good team player. I'm a great team worker. I know how to work in a team and how to respect colleagues. And these are the strengths. And weaknesses also, you can tell them. You're not going to tell them I'm very weak or something like that. The weakness is also in a positive way. You can tell them that I can take extra duties. It's my weakness. I cannot refuse if someone is asking me to do something. It's hard for me to refuse to them, and sometimes I take extra duties, and even though I know that I don't have enough time. So this is the thing you can tell them about your strengths and weakness, and just be confident in answering your questions. Okay, whatever you say it with the confidence, and you're gonna get that job. And also ask them, do you think that you are a team player? They can also ask you that question. You can tell them, yes, I am a great team player, and I know how to work in a team, and then how to handle the situation if we are in a team, if we need to do something. And also for most of the NHS, their core values are working together as one team as well. So you can tell them that the values and values of this trust is working together as one team, and I know how it works. I know how to work in a team, and everybody has respect. Everybody has their dignity and pride, and I know how to be a part of the team. I'm a great team worker. I have good communication skills. I can adjust to the environment. I can adjust in the environment. I'm quite flexible. I'm hardworking, and I'm also happy to listen if someone is making any suggestion, and I'm always happy to improve myself as well. Okay, they can also ask you about why did you apply for this job in this organization. So you can tell them that I like in order to answer this question, you should be aware about their facility. If you are applying in any organization, have a read through about their on their website, what is their core values, why they are hiring the staff, what kind of values and vision they have, and what they can offer you. So you can tell them that in the job description or in your website, I read that you care for your values, you care for your patients, you care for your staff. There is staff retention as well, and a lot of people love working there. I read the comments of the staff as well. They are happy working in here, and your management team is really good. So you can tell them that this is why I apply for this job, and I feel like I'm the right candidate for this job. So it depends on the question, what question they're gonna ask. You can answer accordingly. Okay. Also ask you a question like you're seeing a colleague who is mistreating a patient or abusing a patient. What would you do? So remember, if you are seeing an abuse, or if you are seeing that someone is mistreating a patient, the first thing is go there and then stop that. I mean, you can tell that sorry, excuse me, can I please talk to you for a minute? Just take the colleague away, and then apologize to the patient. I'm so sorry that this has happened. And then when you take the colleague outside, you can tell that I'm seeing that you're not talking to the patient nicely, and it's not good. It's not good. Can you do you have any problem, or do you want to discuss anything? And then after that, you need to report it to the supervisor as well. You need to report to the nurse in charge that I've seen that. And then first of all, you apologize to the patient, take the colleague away, ask them that if there is any problem, if they are worried about anything, if they have any problem at home or something like that. And then if you feel like they are not happy to talk to you about that particular thing, you can tell your nurse in charge that I've seen this and it's not acceptable treating a patient in this way, or talking to a patient in this way. All right. They can also ask you like you went to the ward, and then one patient asked you about can you give me water or something. So how do you know that if they are allowed to drink water or not? So first of all, you can tell them that I will ask my senior member of the colleague if they are allowed to drink, or in the beginning of the shift they give you handover as well. So I'll get the handover in the beginning, and I'll get the handover in the beginning of the shift that this person is not nil by mouth, or if this person can drink or not. And also I can ask whoever is the senior member of my team at that time that if I'm allowed to give water to that person or not. So you need to familiarize yourself with that with the patients, and that's it. Like by handover, or asking your senior member of the team, or in the system as well, you can read I can read the care plan of that patient and see if the patient is allowed to drink water or not. So the job of the healthcare support worker is providing personal hygiene care, personal care. And so if they ask you how do you maintain dignity of the patient, I mean, you cannot just go there and give them personal care, isn't it? So how they can ask you about how do you maintain the dignity and privacy of the patient. So you can tell them that I would maintain privacy at all times. So if I'm giving bed bath, if I'm washing the patient, if I'm giving them mouthwash to brush their teeth and things like that, you need to close the curtain, provide them privacy. You need to close the curtain, ask them if they are happy to have a wash this time, if they are happy to do their mouth care at this time, and if they are happy for you to change their beddings and everything. So get the consent and provide privacy is the main thing. Like ask them if they're happy for you to do it, and then provide privacy by drawing the curtains as well. So this is how you maintain the privacy dignity of the patient. Okay, for a healthcare assistant job, these are the questions you can get. And then obviously they can ask you where do you see yourself in 5 years time. You can tell them that I'll be a better person, I'll learn I'll complete my all competencies, and I'll try my best to go higher in this job. So these are the questions you can get if you're applying for healthcare assistant job in the UK. And then honestly guys, if you prepare well for this question and answer the way I answered, you can get the job 100% guaranteed. Okay. All right, I hope this video was helpful for you. If you are happy with this video, if you like this video, share it with your friends and colleagues who are looking for the job, who wants to come to the UK or apply for this job. And then let me know if you are interested in any other topic about like that. I'll be happy to make a video on this particular topic. So give it a big thumbs up if you like it, share it with your friends, and subscribe to my channel as well, and it means a lot to me. Thank you so much for watching. Take care. Bye bye.